But if the healthy routines conversation's not happening because the view of the provider is that the chemical is going to do all the work of the healing, you're already up a creek without a paddle, in my opinion. The risk here is that psychedelics can be perceived the same way, where the MDMA or the psilocybin or the ketamine is going to be the agent of change. And my job, and I'm exaggerating a little bit here to make the point, is my job as the patient is to lie back on this easy chair and let the magic of the chemical do its thing to me, as opposed to here's an ally. It's going to maybe open some doors in your mind, help you re-examine the way you think about yourself.
Welcome to the Health Fix podcast, where health junkies get their weekly fix of tips, tools, and techniques to have limitless energy, sharp minds, and fit physiques for life. Hey, health junkies. On this episode of the Health Fix podcast, I'm interviewing Dr. Will Vanderveer. He's a global leader in integrative psychiatry. He's transforming mental health care by addressing the root cause of conditions. And today we're going to be talking about psychedelic medicine and the different trial he's been on with MDMA. We're just going to dive into where a lot of us are becoming dissatisfied with the conventional psychiatric approaches, and really how Dr. Will's pioneered holistic treatments that do focus on diet, lifestyle, mindfulness, gut health, hormone health, and all the things to help address chronic stress and psychological suffering that's going on in the universe right now. Now, Dr. Will is the co-founder of Integrative Psychiatry Institute. He trains hundreds of psychiatrists and other docs, including naturopaths, in MDMA, ketamine-assisted psychotherapy, and also works quite a bit too with psilocybins. And so this is great stuff. Man, he's got a lot of knowledge, and just hearing his research background side of MDMA and its impact on PTSD is mind blowing. If someone you know is suffering with a mental health condition, or you yourself are struggling and you're not seeing results with traditional methods of counseling, medication, even diet and supplements, this podcast is for you. It'll help you to get some insight into some of the up and coming therapies that have been around a while, but now they're gaining more popularity. So let's introduce you to Dr. Will Vanderveer. Dr. Will, welcome to the Health Fix podcast.
Great to be here, Jannine. Thanks for having me.
Hey, no problem. I was definitely going to tell everybody in the intro, but I'm telling it now. I have to join your program because I'm so excited about this in terms of offering psychedelics to my clients and just helping folks expand their capabilities in terms of their health. So, of course, we got to talk first and foremost and get to the basics with you. How did you come to psychiatry in the first place? And then what brought you to psychedelic medicine?
Well, it was a bit of a winding road for me. I wasn't pre-med in college. I was studying anthropology and art history, and I had a mentor who I was doing an independent study with, and he was a researcher in the field of genetics and schizophrenia, and he sent me to the hospital on the campus where I was in Philadelphia and said, "Go interview these people," and they were folks who had been hospitalized in acute psychosis. And I had this weird kind of full body, oh, these are my people experience when I walked into the ward. And so it was my senior year, and I had to pivot and decide to go do all my pre-med stuff after graduation, and then ended up in medical school with a pretty good idea that I was probably going to go into psychiatry. But I almost got derailed because I loved the body so much and physiology and just how things work in general. So, but I stayed the course and ended up out here in Colorado for my residency program. But having come from my background with anthropology and studying how different groups of people do healing, I was always already pretty skeptical about reductionistic thinking and medicine, and particularly in psychiatry, the one pill for one ill and the notion of a chemical imbalance in the brain and so on just never really rang true for me. So I was a skeptic, and then I had a big sort of cratering out of my excitement about practicing psychiatry when a couple of years into my practice after graduation, I just had more and more people entering this category that we call in medicine treatment resistance. So people who weren't getting well from psychotherapy, they weren't getting well from medications or a combination of both. And I just felt like I was getting crushed under this, the weight of all of these people not responding to what I'd been trained to give them for treatment. And I decided to take a year off and just go meditate and try and figure it out. So I closed my practice. And deep down, this was in 2004. Deep down, I thought I wasn't going to ever come back. I thought, okay, here's my big escape. I'm going to be like a meditator or something. I don't know what.
Right.
And then I ran into, I think as a naturopath, you'll probably love this. I went back I was living in this tiny town 4 hours from here and called Cresttown. It's
Oh,
a really interesting community.
uh-huh.
You've heard of it.
Oh yeah. Oh yeah. That's where you go to get the deeper side of things.
Yes, exactly. And so I'm meditating hours a day and, pretty much like full-time meditator. But I would come back to Boulder and fill the entire car with groceries and go back. And so I was in Boulder for one of these grocery runs and I ran into this former patient who I had treated for generalized anxiety. I did all the things, SSRI, benzodiazepine, cognitive therapy. And he pretty much didn't get much benefit from what I did with him for over a year. We met once a week for over a year. So I ran into him and he says, look, hey, I wanted to give you some feedback. First of all, thanks for the therapy. I really appreciate that. But I want you to know that I went and saw a naturopathic doctor after you left town.
Oh no.
I got tested for celiac disease, came back positive, stopped eating wheat. And over about 6 weeks, my anxiety completely went away. And then I went gradually off my medication and I still have no anxiety. And to this day, I stay in touch with him. He lives close to me. He still has no anxiety. And that was a massive turning point for me because I realized that it wasn't a problem with psychiatry. I was the problem. I didn't have enough education, enough understanding. I needed to get outside the box. So that put me on this integrative medicine track and led down the road to eventually to psychedelic therapy.
Oh, go figure. I mean, I can resonate. I can resonate, right? Because when you're working so hard with someone and you've worked with them so long, and then you do see them and they're like, "Hey, I saw this helped me." You're like,
Mm-hmm.
or you're like, "I had no idea about
Yeah.
this." And I
Yeah.
definitely have come to that in my practice, and that's why I'm looking into the integrative psychiatry side of things because I'm going, the diets, the supplements, my side of things isn't doing the trick. People are getting sicker. And I'm sure you've probably seen this too in the last, probably since COVID.
Yeah.
Really, there's a lot of energetic imbalance in folks.
Very severe. Yeah. Hockey stick. Scary.
Yeah, it is. It is. And so it's like, okay, where do we go from here? And definitely the psychedelics folks are starting to come across them. They're going, okay, doc, where do I go for ketamine? Where do I go? How do I get a hold of some MDMA? How do I,
Mhm.
who should I go to for a psilocybin journey? And I'm literally, besides the nurse practitioners that I know with ketamine, you know, practices, I'm like, I don't know. I don't
Yeah.
know because I can't trust it. And I'm sure you've probably seen that since you've created
Yeah.
programs to help support
Hmm.
folks like us.
For
No.
sure.
Yeah.
Yeah. Yeah. The interest in psychedelic therapy really skyrocketed with Michael Pollan's book in 2018. And then, as you pointed out, in COVID, we saw this massive rise. It was already I would say, a global pandemic of mental health challenges, but after that, it just went off the charts. And we're trending toward, just to give folks a context. It's predicted by 2030, which is just a few years away, that depression will be the biggest cause of disability in the world. We have about 350 million people worldwide with depression, and about a third of them end up in this thing that we're calling treatment resistance, which I don't like the term because it kind of blames the client a little bit. Um, I prefer to call it practitioner ignorance, is what we call it at our institute. because there are things to learn, and there are ways, as you pointed out. The excitement about psychedelic therapy is that it seems to be uh, very effective, particularly for these people in the highest need. So it's very exciting. And yeah, we can talk about all the different things, like where things are available, what the differences are between the different medicines, who they can be right for, wrong for, and so on.
Absolutely. I would love to go into that because, I'm sitting here where clients will come to me. It's almost every day now. Someone's like, "Hey, what do you think about this? I saw this come across my screen online. This person's offering this." And really the biggest question is between these various psychedelics out there. Yeah, how do we choose and how do we know what's right for who? Love to learn that.
Well, and I think it also depends on how it's practiced as well. So as you're pointing out, so we in psychiatry we still, in mainstream psychiatry, we still suffer from the medicine is the treatment, the antidepressant or whatever the chemical is you put in your mouth is the treatment. And so the risk here is that psychedelics can be perceived the same way, where the MDMA or the psilocybin or the ketamine is going to be the agent of change. And my job, and I'm exaggerating a little bit here to make the point, is my job as the patient is to lie back on this easy chair and let the magic of the chemical do its thing to me, as opposed to here's an ally. Um, it's going to maybe open some doors in your mind, help you um, re-examine the way you think about yourself, help you look at some of the traumas that you've been through and the conclusions that you drew about yourself and the world you live in from the traumas, and give you an opportunity to redesign your internal landscape. Now, that's easier said than done, but I think the opportunity is what happens in inquiry, with the support of the chemical on board. So I think the framework is important.
Absolutely. Absolutely. Because I would be lying if I said, even in the naturopathic realm, and maybe it's different now in terms of our education, but you still are within the medical system where it is the thing is going to fix the problem, not you as the
Yeah.
person. It takes all of that off of you. And I still have people that come to me and say, "Doc, fix me." And I've debated
Yeah.
about changing my podcast title because I don't want people to think it's fixed. It's more like a junkie getting their
Mm-hmm.
fix in terms
Mm-hmm.
of information, but at the same time, context of how we think about these things. Because yeah, I have
Mm-hmm.
so many people that are like, "I'm going to go do my ketamine and the ketamine is going to solve all the problems."
Yeah. Yeah. It's, and I have a lot of compassion for people in deep suffering who all they want to do is just feel better. I totally get that. But, if you think about it, if you want to experience a long, healthy, vibrant, enjoyable life, it takes work to maintain our health. It's not like it's not given to you, right? You can't um, lie on the couch and not exercise and think that your body's going to feel good. You can't eat junk food and think your body's going to feel good. So, telling people to go exercise and change their diet when they're very depressed is a non-starter, right? So we have to help them. We have to catalyze the change and give them a leg up so they can actually get into healthier routines. But if the healthy routines conversation's not happening because the view of the provider is that the chemical is going to do all the work of the healing, you're already up a creek without a paddle, in my opinion. Um, and I realize I'm kind of preaching to the choir, here with speaking this way with you and your audience. But it's worth mentioning that when you look at clinics that provide ketamine, most of the people providing ketamine in the context is not with psychotherapy. It's not with this deeper, more holistic vision that you and I share. It's more like, here's your treatment. We'll collect your $1,000 session, and you'll come back next week and get another one. And it's sort of like, one practitioner at a conference said, I think, it's a little sinister, but I think it's accurate. It's like the patient is an annuity for the provider, right? The whole idea of chronic medication that you have to take for the rest of your life is an economic framework that sustains. Uh, I wouldn't say, I don't think practitioners want to be in that framework either, is the thing. So we want to see people get well and stay well, at healthcare or mental health care behind them as much as possible. So I'll get off my soapbox there.
Oh, I mean, I'm right with you on that. Well, I'm right with you because I'd much rather have someone come in a couple times than I see them on the street and they're all good.
Yeah,
That's
totally.
that's the goal. Or they come in only to get a little tweak,
Little boost.
and we
Yeah,
just little boost, little tweak. We just do a run of labs and make sure all's good. I mean, I'd love that. I would love
yeah,
that to be where things are at, but unfortunately, we still I cringe every time I practice when I'm like, it's been months and I'm like, I cannot get to the bottom of this with this person.
right.
I used to beat myself up and say it's all my fault. I'm a dumb doc. I don't know what I'm doing, and of course lots of therapy later,
Sure.
here we are. But
Yeah.
but one of the biggest, I think, misconceptions, like you're saying, and one of the things with different practices, much like the ketamine clinics I've seen, is it's much like I joke as like a hormone clinic in a strip mall. You go in, you
Yeah.
get the thing, you come out, and life's supposed to be better. Um, and this is where I definitely want to pick your brain because I've had multiple patients go into these types of clinics looking for solutions and then end up in my office in a state that they can't get out of, where
Hmm.
we're trying to work on things and they have no psychiatrist, they've never had a psychiatry, appointment, they've only had counselors, and I'm sitting here
Right.
trying to figure out what do I do. And so
Right.
I'm guessing you've seen this happen over and over again too.
Yeah. Unfortunately, we at our clinic, which is, it's an integrative psychiatry clinic, we see, uh, we call them refugees from intravenous ketamine clinics or, other formats where people are getting um, ketamine without the psychological support. Uh, the latest, since COVID has been the suspension of the Ryan Haight Act, which prevents people from providers from prescribing controlled substances without seeing the person face to face in person. So now we have a widespread practice of online ketamine prescribing. Um, Not all of the online ketamine prescribing is uh, taking advantage of people. I want to say that, but people are using these really powerful tools at home with no support, which is kind of similar to going to an IV ketamine clinic and being put in a dark room where somebody pulls a curtain, but like in an emergency room environment, and there's no person there. There's no prescriber there. There's no therapist there. And people can get really blown out because what happens when you take a psychedelic is, and the term psychedelic means mind manifesting. So what's in your mind gets amplified. And, when you're working with people with depression and anxiety, then they're going to have things in their mind that have happened to them in the past that get amplified. And they may not even be told that that could happen on ketamine, and all of a sudden they're having a panic attack, or they're re-experiencing in their body an assault or a terrible experience that they had, and they don't even know what's going on. It's just terror. So that's why we really believe, and we teach in our institute, that with these powerful tools you need to have someone there with you to help you navigate the journey and keep you anchored in your experience. Otherwise you could get re-traumatized.
And that's exactly what I've seen in my practice when folks have gone, not every time, but I definitely don't want to scare folks that that's what's going to happen because it's not always that case. But what do you see as being kind of like how do you guys do it? What do you recommend in terms of work up to
Mm-hmm.
actually having ketamine? And let's talk about what kind of person's a good fit for ketamine. What kind of things might be they be experiencing? And then how do you guys work at the Integrative Psychology Institute? How are you guys
Yeah.
working?
Yeah. So ketamine
Psychology,
and it's no problem. Integrative Psychiatry Institute. Um, Ketamine seems especially helpful for people who have tried and failed other options. So maybe they've tried a couple different psychotherapies, maybe a couple different medications from different classes. Like, maybe they took an SSRI, maybe they took Wellbutrin or SNRI, and didn't get anywhere. Um, These are the kind of people who often respond really well to ketamine. It's not for everyone. There are certain psychological and medical rollouts that need to be looked at carefully to make sure that it's the right fit for that individual. Um, so we do an hour long assessment to make sure that it's a good fit for people before they come in and have their sessions. And then we follow what seems to be the best evidence-based protocol for to get the most long-lasting benefits from ketamine therapy. So it's a for severe depression, treatment-resistant depression, it's twice a week for 3 weeks. So 6 sessions in a very short time frame, and it's pretty cool to see 80% of people go from severe depression to minimal depression symptoms in 3 weeks. When they've tried for years or longer to get well with other methods.
Wow, that's impressive. That's impressive. I didn't realize it was that high, 80%. Holy cow. Holy cow. Wow.
It's powerful. The biggest drawback with ketamine, and it's real and definitely needs to be talked about, is the durability of the benefits. So this is where I think the holistic or integrative perspective is critical, where you're taking, as you screen someone for the ketamine treatment, you're also looking at, well, what is their life? Are they sedentary? Do they have a C-reactive protein of 10? Are they highly inflamed? Um, do they have a big trauma history? Um, what is their diet like? What is their relationship environment look like? How's their sleep? So you're looking at targets for lifestyle medicine that you're going to want to really get after as soon as the person is starting to feel some relief from their depression. And sticking to that game plan, I think, has a huge impact on, you could say, from an economic standpoint, what the return is on your investment for undergoing ketamine treatment, because it's typically not covered by insurance. It's a big outlay for a lot of people.
Yeah. Yeah. That's it. And that definitely is for a lot of people a barrier. And also why I will see some people turning towards the psilocybins
Sure.
and finding, the person around the street, or as I call it, the psychedelic tourism types of packages that they'll find online. They'll be like, "Oh, I can go to Mexico and have a journey at the same time." I would
Hmm.
love to get your take on ketamine versus psilocybins. Who would
Hmm.
that be for compared to someone that would be better suited to ketamine? And then, of course, I want to hear what you think about the psychedelic tourism.
Well, so maybe we should start by talking about the medicines and how they're different, and the legal differences and so on at this point in time. First of all, ketamine's been around as an FDA approved anesthetic since the 60s. It is being used off label for mental health. So it's worth mentioning that generic ketamine, IV ketamine, is not FDA approved for depression, but the level of evidence is so high, and the prevalence, the availability of it is pretty high at this point. Um, there is an FDA approved version of ketamine called Spravato. That's a nasal spray. But frankly, the effectiveness of Spravato is way less than IV ketamine for treatment resistant depression. Psilocybin is different in that it remains on Schedule 1, which means it's a felony to possess it or to distribute it, and so on. So it's important for people to realize that law hasn't changed about psilocybin, even though on a state by state level we have Oregon and now Colorado that have embraced psilocybin as an option for people with significant depression. So things can be legal on a state level, but illegal on a federal level, which marijuana, you could say, is kind of a similar thing at this point in time. So what's exciting about psilocybin is that, first of all, it's been around for thousands and thousands of years in indigenous use, and not just in Mexico, where it kind of hit the press in the 1950s, but Siberia, South America, all over the world, there are shamans who've been working with psilocybin. So it's considered to be, from a physical standpoint, extraordinarily safe, um, very safe, very difficult to overdose. In fact, I don't think there's a single case report of someone dying from eating too much psilocybin. Um, you can get into some really difficult psychological territory, and you can have long lasting flashbacks and psychological problems. Usually these problems resolve within a few weeks or months if they occur as a side effect of psilocybin, but the psychological risks are real, even if the medical is pretty safe with psilocybin. So people do leave the country if they, live in a state where they can't access it legally. They, as you said, tourism with psychedelics is a huge industry. The problem with that I see with these, and I'm just basing this on my work with patients, and having people come back from places in South America that they maybe responded to, they made a reservation from like a Google ad or some kind of marketing, as opposed to my best had a great experience, so now I can sort of like a word of mouth close in referral, I think, is way safer than just like some kind of like flyer that you got in your mailbox kind of thing. So, so having said that, I think the context of indigenous healing is a very, very different framework of even the idea of like what is actually wrong or what's out of balance inside of you is a different conversation in a non-westernized, non-industrialized medical conversation. So I tend to think about indigenous rituals of healing with or without plant medicine as spiritual in nature. Your connection with yourself, your connection with others, your connection with Mother Nature are things that come into focus often in these contexts. And that can be incredibly powerful and beautiful to have healing in those areas of your life. But in terms of like going in to directly try to unravel um, the knot of trauma in your mind, or to directly address treatment-resistant depression, these are not frameworks or phenomena that that indigenous healers usually have much familiarity with, or that they may not even embrace that as a concept. So I think sometimes people go with psychological suffering and feeling aligned with and bought into a Western framework of disease, let's say, or illness, and they go and experience a mismatch in the framework of what's actually happening in these traditional ceremonies. So the sophistication or that's not the right word, the um, the ability of an indigenous healer and the background and training of an indigenous healer is not really relatable to a person who's coming in with, look, I have treatment resistant depression as my condition, and I'm here to heal that.
Right, right. Yeah, it's such a different, and then we've got cultural language barriers
Right.
too, and trying to explain all of that. Yeah, I can see for those folks who, maybe it's mild, you just want to explore things, that might not be a bad thing. But for those who really are suffering and have, not found solutions, I'm very leery of
Mhm.
those types of care. Now, another thing that I've never talked about on the podcast is MDMA
Mhm.
and where things are legally with MDMA at this point, and who might benefit from MDMA.
Well, I'm glad you asked. I have a long background in clinical research of MDMA therapy for trauma. And so what I see is MDMA coming when it becomes widely available, which I think it will. Right now, it's in phase 3 clinical trials. It came up for FDA consideration um, this past summer of 2024. FDA decided that more research was necessary before they consider approving it. So it looks like another phase 3 trial is going to be necessary at this point. But the efficacy, so the effectiveness and the safety the evidence is excellent. And what I mean by that is the trial that I was a part of here in Boulder, Colorado, we treated people who on average had about 29 years of PTSD in their lives. So very long-term chronic PTSD with, you know, oftentimes hundreds of hours of therapy, many different medication trials. So people who had tried and failed a lot of different attempts to get well. And 2/3 of the folks who came through the protocol no longer met criteria for PTSD at the end of the outcome of the study. So these rates of recovery from PTSD are unheard of from ordinary currently approved treatments. And so that's maybe in a nutshell why MDMA therapy is so exciting, is that it offers in a protocol where you only take MDMA 3 times. And, we could go into the detail there, but the protocol is about 5 months long, and you have an MDMA session once a month for three occasions only. And these are the folks who are, at the 2 month follow up, 2/3 no longer meeting criteria, and at the 1 year follow up, even more than that, not meeting criteria for PTSD. So it seems to be a very long lasting intervention that has profound impacts on a person's system.
Wow. I I definitely think about it for a lot of folks, and I think the biggest thing is trying to connect with one of the research groups and
Right.
where research is actively happening. Are you involved in any research right now?
Not at the moment,
Okay. Okay.
but I certainly keep my finger on the pulse and have a lot of friends who are still doing that beautiful work. It's long, and it's frustratingly long, and sadly there are so many people who are dying by suicide waiting for a more effective treatment to come around. So it, it it's time for better treatment options to be available for people.
Absolutely. Absolutely. Do you find that with MDMA, it's well received in certain populations, like men, women, veterans? I'm just kind of looking at like what types of PTSD, if there's a type of PTSD that it seems to work better with. Just questions I get from patients.
Great
And
question. Well, it's interesting. I had the same question going into doing the work in the clinical trials, and I was wondering, is combat PTSD more effectively treated than, say, PTSD from a car accident or a sexual assault or childhood PTSD and childhood trauma? And it was very, very interesting to me that most of the people who I interacted with who came through our trial came in with what we call an index trauma, which is a research term for like the reason why you have PTSD is because X happened to you. And almost universally, when the MDMA kicked in the dosing sessions, people start to go back further into their history and find out that there were a lot of things that happened to them prior to the so-called index trauma that created enough of an impact on who they were that the way that they responded to the index trauma was different from how they might have responded if they hadn't had earlier trauma, which is maybe a long-winded way of saying that it seems like with MDMA, when the circumstances are right and the therapists are there and they're well trained and it's a quiet, safe environment, the person's mind can relax enough that they can go back in time to the earliest experiences they've had. So we saw people working on multiple levels of trauma in their history, kind of floating from, early childhood back to the thing that supposedly brought them into the treatment protocol and back and forth and working on multiple levels at the same time. And so I didn't come away thinking X, Y, or Z type of trauma was most suitable to MDMA therapy. I came away thinking that people can work on very deep material with MDMA, or they can work with very recent things that have happened to them. I guess the only nuance I would share about that is it seems like the more layers or the more early trauma a person is dealing with, it seems like the more sessions they need to take care of it. So someone who doesn't have PTSD, who gets into their 30s or 40s or 50s and they have a terrible car accident and now they have PTSD, uh, if their earlier life is relatively free of traumatic experiences, then they might only need one session to work through that material and put it behind them. We saw people in the trial who felt after they took MDMA one time that they got all the healing that they needed and left. That happens. But there are also people who I think are going to need more than what the research protocol is allowing for of 3 sessions.
Makes sense. Makes sense. I mean, I think that's important for anyone that's listening right now that in pondering like, well, how much time would I need? And of course, the
Mm-hmm.
investment is always
Sure.
what people are looking at, especially the most experience obviously I have is the ketamine because it's the accessible, right, at this point. And so, I think it's important to really explain like it depends. It all depends on, what your body's opening up to, what you can physically handle. And and this is where I also get another question. Maybe you've also had this kind of question. A lot of folks are now starting to get into energy healing and working on, mindset and trying to work that level of things. And some folks are saying, well, I don't want to try something else. I want to just use the ability to change my mind and manifesting and things of that nature. What would you say in terms of folks who are looking at that versus looking at the psychedelics? How can maybe you integrate them? How could you kind of think about the process of like, well, mindset work and like brain rewiring? That's probably the word I'm
Mm-hmm.
I'm actually going for.
Sure.
How would that differ from psychedelic, or would they be better put together? Or would one amplify, as I'm suspecting psychedelics would amplify the brain rewiring process? But I think a lot of people think in other, and or one or the other kind of terms.
Well, I think there are more than obviously there's more than one way to get well, and for people with chronic conditions, oftentimes there's layers and different aspects that need to be handled. It's not just one thing that they're going to need. Um, for example, the phenomenon of inflammation is really common in chronic depression. So things that reduce inflammation can be really, really helpful for that person. They might also need mindset change. They might also need psychedelic therapy. In the case of psilocybin or ketamine, then they might be getting some of those things all in one, right? They're getting um, an opening into their mind that the chemical helps. They're getting mindset shifts from insights, and they might also be getting anti-inflammatory change that's happening directly from the drug. I think that energy healing and mindset shifts can be a really powerful. I mean, I've seen people who tried and failed the conventional treatments go, to dynamic neural reprocessing training, DNRS training, go to spiritual retreats, go to energy healers in Brazil, or different. You don't need to go to Brazil to find energy healing, but there's as many different kinds of ways to get well that work as there are people, I think. So I think it's important to keep an open mind to that and keep looking and not give up when the things that are presented to you or offered to you that sound like they're going to help you, that you try, they don't work. It's easy to get to feel defeated and deflated when things don't go well in treatment.
Yeah. Yeah, I definitely have felt being an empath. I can feel it, right? When folks don't get better and things are, shifting, it's hard. It is so hard and trying to find the right thing and what to invest in and whose program to do and
Mm-hmm.
it becomes very difficult. And this is where I love that you're offering programs for docs, naturopaths. Guys, this is a big deal. I'm very honored that he's offering us naturopaths into the club because not no, there's no other program that accepts naturopaths in that I'm aware of. Even the MAPS program, there was a little bit of glitches in that system too for
Mm-hmm.
us. And so I'm very excited that you're offering training for docs and nurse practitioners and pretty much it sounds like anybody that's in the medical field that can work with mental health conditions and issues.
Right. We're training licensed clinicians, mostly across the board, and but we want to make sure that people have enough of a mental health background. And I don't worry as much about naturopathic doctors as I would, be worried about, say, an anesthesiologist who, yeah, has zero training in, how to sit with people with mental health concerns or challenges. In primary care, of course, I think the rate I saw in one study was 80% of the challenges people are facing. They come in. When I say primary care, I mean naturopaths and, allopathic physicians. You're dealing with mental health all day long. So, if you don't have tools, you're going to be burnt out pretty quickly. And that's real. I mean, with the level of suffering that's happening in the world right now, we see a lot of practitioners come into our programs with high levels of burnout.
You know, that's a very interesting thing that you bring up because I noticed in somewhere you were talking about medical providers must embrace their own healing journeys
Yeah.
to really fully step into our ability to help folks and this is something that even as a naturopath I didn't grasp it fully because I think Bastier at the time was trying to really educate us on being very close to Western so we kind of fit in a little bit more. So I kind of look at it as I don't think I fully realized that I had to take care of the mental health for me too. Because boy, yeah, burnout is real. It is real in our field.
Yeah.
And kind of, I think even more now since COVID, I just really have seen so many fellow doc friends of mine being like, I'm quitting, I'm done. Forget this.
Yeah. And there's so many reasons that people are, feeling bad as practitioners. I mean, documentation, pre-authorizations, and dealing with insurance, having to see, 20 or 40 people a day in primary care to make ends meet. I mean, the list, student loans. I mean, the list goes on and on and on. It's really stressful, and it's particularly stressful for healers to not see results in the things that you're doing. And you mentioned earlier feeling discouraged. I think what that kind of feeling of like, is this something about me that as a practitioner that I'm not able to accomplish what I'm trying to do with people? No, it's like we aren't given complete information in terms of like the wide range of different ways people can get well and what to offer people at the right time and the right place. And so um, coming into a learning community can be a huge leg up in terms of realizing that you're not alone in the suffering that you're experiencing. And to be a healer means to take pride in your work and your ability to get results with people and feel good about those outcomes. And if our tools are limited, I mean, I told my story earlier about quitting psychiatry because I just was so discouraged. And um, so I'm actually, that whole vibe has really flipped around in my mind as I've uh, seen the results that these new tools can offer people. The prospect of helping someone who's been, under the wheel of symptoms for decades, put mental health care behind them is pretty exciting.
Yeah. Yeah. I mean, that's definitely what I'm looking for here Now, of course, with your training for folks, I think it's important to share with the audience kind of how would they find, so if they're looking, obviously I'm sure you have a practitioner list, but I'm also thinking if someone's looking to work with a ketamine clinic and or looking to get on in some a group for some MDMA research, where are like what are some of the key components to look for in terms of the practitioners or the clinic or the facility? What kind of things are highly recommended in your opinion that someone wants to be looking for
Mhm.
to be sure that like, okay, this is a solid place? And I'm probably talking a little more towards ketamine because
Yeah,
MDMA is more controlled.
right. So the clinical trials you mentioned, we'll cover MDMA first and then go to ketamine.
Hmm.
There, the organization you mentioned before, MAPS, was is the sponsor of this research on MDMA for PTSD. So getting on their newsletter is a great place to start in terms of keeping track of opportunities to join clinical trials. That's maps.org is pretty straightforward, MAPS. And the company, so MAPS started a pharmaceutical company that lives underneath the nonprofit MAPS, and it's called Lycos. So Lycos is now the organizations that's holding that phase 3 research on MDMA. So those are good places to look for that. With as far as vetting out ketamine clinics, I think the main thing is making sure that there's someone on staff who has a good foundation in working with depression and PTSD. So someone with licensure in the mental health field. It doesn't mean that the owner or the medical director needs to be a therapist or a psychiatrist, but if that provider, that owner, is an ER doc or they're an anesthesiologist, which is commonly the case, if they're the only person there and they don't have a therapist or a psychiatrist or someone with a really solid mental health training background, then I think you're going to be at higher risk of having an experience like I talked about earlier, where you are given IV ketamine in a dark room and you kind of fend for yourself. So there, there's a professional organization of ketamine providers called the American Society of Ketamine Practitioners, ASKP. You can find out about members over there. Um, our practitioner list is a good place to look too. We have hundreds of people that we've trained in ketamine therapy, and we beat the drum pretty hard about including the mental health component, the therapy component with the ketamine. So I think you're unlikely to find a provider who isn't going to, round out the approach on our website, which is psychiatryinstitute.com.
Makes sense. Makes sense. I mean, ultimately, my biggest concern is safety and getting results and making
Yeah,
sure if folks are going to put the effort into spending the money on ketamine or spending the money even on psilocybin, type of journey, I'm hoping that there's going to be some lead up and follow up afterwards to be.
absolutely. That's critical to be well prepared and to have plenty of time to integrate the insights that you developed on your journey.
Yeah.
Really important.
Crucial. Well, I am so glad you're doing what you're doing, and I'm just like I said before, I'm so glad you're letting the naturopaths come and have some training too, because I think it's very important for everyone to have, a chance, right? To be able to help their patients on the deepest level they possibly can. So of course, let's go back to you had briefly mentioned your website. I know you're on social media too. I want folks to be able to get access to you guys at the Integrative Psychiatry Institute and just learn more and be able to like if they're in Boulder, I guess my other question is if they're in Boulder, can they pop in and and see you guys and consult with you?
I mean, people who are in Boulder can give us a call. They can reach out to us through our website. They can email us that way. That's the easiest way to get a hold of us. Um, so they can look us up in Google and find our phone number for our clinic. The um, the easiest way to sort of connect with us and hear more about what we're up to is by listening to our podcast, which is the Higher Practice Podcast. It's on all the platforms like Spotify and Apple Music. And just going to our website and looking around and seeing, reading our blogs, and you can find our podcast there too. It's called psychiatryinstitute.com. So not easy to spell, but pretty simple to say. Um, and yeah, we're our mission here is to bend this hockey stick that we're seeing in mental health globally, and make a change by helping providers gain access to better tools.
Absolutely. I think that that is going to make a world of difference. And I'm so glad that you're doing it. And I look forward to listening to the Higher Practice podcast, folks. Check that out as well. Good stuff there. I checked out some of your topics, and like all good stuff I get questions on all the time. So I think it's going to be great for you guys, especially if you guys are definitely wondering more about the world of psychedelics and how that might be a fit for you. Dr. Will, thank you so much for coming on.
Thanks, Jannine. It's been great to be here. Really appreciate it.
Hey, fellow health junkie. Thanks for listening to the Health Fix podcast. If you enjoyed tuning in, please help support me to get the word out about the podcast. Subscribe, rate, and review, and just get that word out. Thanks again for listening.